Hello, everyone. This is Mark Haskelson. I'm the president of Compliancy Group. Thank you so much for joining us today. I apologize. I understand there may have been a little bit of a mishap of when the webinar was starting. It is planned to start officially at 2 o'clock Eastern Time Zone. So I'm sorry if any of you folks joined earlier. Just a little bit of a go-to-meeting snafu there, or go-to-webinar snafu where it thought we were starting at 1:30, not at 2 o'clock. That was just to make sure I was here on time. So as we go through today, I will do my best to make this interesting and exciting. Please, if you are looking for educational material, there's a whole bunch of both our upcoming webinars that are specifically for the AOA or our past webinars that we've done for the American Optometric Association. So you are welcome to visit our website, download, view those, share them with your staff. Some of them are CE credit approved, etc. There are lots of free resources on our website. It's part of our commitment to the American Optometric Association that we are actively trying to provide content. I understand today's free thing is going to be a free fax cover sheet. So for those of you who've logged in, I believe it should have given it to you when you first joined. If for some reason you didn't get it, please either reach out to me in the question section, or if you visit our website, we can send it to you, or if you drop me an email, it'll be my pleasure to send it to you. So throughout this webinar, please do ask questions. Actually, a couple folks have already posed a couple of questions. I don't mind. You can pose them throughout the event. I'll do my best to get to them either during or at the end of the webinar, as well as during the webinar. If you have, if we do run out of time, just know that I will make sure that either myself or somebody on my staff responds back to you. Okay, so let's start. So today we're going to talk about HIPAA Compliant Communications, and specifically with your patients. This comes up a lot. There's a lot of times I'm speaking at different events with doctors and their staff about, whether it's social media or direct communications to their client, to the patients, what's the right way to do that, or do that in a way that is truly HIPAA compliant, which means you're respecting and protecting your patient's information, but also the opportunity for you to do business with them. One of the things that I think is very unique with the optometric community is that so much of your business is done through what I would call retail, not medical, and that therefore your patients often look a lot more like a consumer than they do just a patient. And communication and let's call it good marketing are an important part of that. So today, that's what I'm going to do my best to kind of bring you through some ways to do that. For those of you, if you are not familiar with Compliancy Group, if this is the first time, our seal of compliance is an industry standard. Our goal is to simplify compliance for our clients so that they can confidently focus on their business. We are very proud we have been at this for 14, almost 15 years. We have something like 80,000 users across the country. We are endorsed by over 40 of the medical associations, including the American Optometric Association, and a tremendous amount of what is the eye care business, many of the ESLR entities, organizations at Octuco, Coherent Eye, Itopia, Vision Trends, First Eye, PERC. We're very proud of the relationship with PERC. Actually, there's a great case study coming up on our website of where we helped Dr. Golden protect his practice during a meaningful breach. So what that says is why you might care about what I'm going to say about, and you may not care that much about HIPAA, is we have never had a client ever fail an OCR, that's a HIPAA, or that's a HHS HIPAA audit, or a meaningful use MACRA MIPS audit. So our seal, if you bear it, is a great differentiator, and also protects your firm. That if you are audited, you know that my staff with 20 plus years of heavy duty compliance auditing expertise, ex-auditors on our team, are to be the ones that are going to defend you to prove your good faith effort. So we are also in the world of eye care. We are very proud to be supporters of both Think About Your Eyes and the AOA PAC. I am a fourth-year visionary level contributor personally to the PAC, and we are officially the endorsed solution for eye care by AOA Excel. Okay, so now enough of all that fun stuff. Let's get into educating. So the first thing you have to understand when it comes to what is compliance, okay, or HIPAA specifically, is that this isn't a bunch of fancy tech stuff, okay? What the government wanted was your simple commitment that you look at your organization every year. There's 6 specific audits that are to be done, that you identify your gaps and you remediate those gaps. There's a bunch of things you need to do. Why I stress that is, it is the when an auditor, when they walk into your office, they don't want to see a checklist of a bunch of things you did. What they are going to specifically ask you is to prove that you have satisfied the 7 fundamental elements of an effective compliance program. Now, you may say, Mark, what does this have to do with patient communications? That is what I'm going to teach you throughout this particular webinar, is how that relates to what is how you communicate with your patients specifically. Okay, so for example, you must have written policies, procedures, and a standard of conduct. Okay, there needs to be somebody designated at your organization that is the protector of, call it PHI, protected health information. The concept of effective is training, education, lines of communication, monitoring, and auditing. Okay, and that be depending on the size of your practice. That can be simple things like, hey, we keep track of who comes and goes every day, or larger multi-site practices where you need to have actual software that is analyzing who is logging in and when. Okay, you must have disciplinary guidelines, which means in regards to communications, if someone didn't follow the rules, right, they sent something they shouldn't have, they should know that the violating of that rule could be suspension, could be firing, okay? And they do have to apply to everybody. The last thing, and this does often relate to communication issues, if there is an offense, once you have identified it, you must investigate it and then report it based on what you found. So a meaningful breach. So if you accidentally fax something to the wrong doctor, to the wrong office, okay, you need to investigate it, identify what went wrong, fix it, i.e. I just typed in the wrong numbers, or maybe it's a bad fax machine. Maybe it is you have a training issue with your staff, and then report that to the appropriate government authorities. Okay, so from there, let me get into more of kind of, as we're talking about what is communication and how it happens. So what is communication? So in its most basic form is how you communicate with people, right? And there's all sorts of great ways, and you should be, I think you should be training your staff on things like DISC profiling, if you ever heard of that. I know that's a big part of PERC training stuff is where they have that. But in the end, how two people talk to each other can easily be misunderstood. Therefore, there are lots of great tools to help us increase the frequency and the clarity of that. Okay, so now what are some of those? So whether it's two people looking at each other, mail, computers, social media, direct texting, calling or sending an email, all of these are mediums of sharing information with your patient, okay, or potentially other doctors. Now, in those sharing of communications, if I was to go deep into, let's say, the details of the law, you have obligations to prove that when you shared PHI, it was done in a secure fashion. And I'll talk more about it as we get into this. But for whether it's a file, whether it's a phone call, USB devices, pictures, for example. So if you took a picture of someone's face, let's say a particular eye issue, right? Understand that you can't just post that somewhere, because even though it's just zero, even though you let's say, cropped out what is the majority of their face, most people's eyes are very specific, and therefore it could be identifiable. The way to think of PHI or data, protected health information, is any identifiable form. Okay, so does not matter. I hear this a lot. Well, what's the big deal? I texted it. Yeah, that's secure community. That needs to be secure. My computer, whether it was, or even if it was verbal, spoken, things overheard in an office. Now, so why is getting so harder and harder to deal with these things is HIPAA is a 20-year-old law. It was established in 1996, kind of before a lot of this technology showed up. Before you had things like ransomware and spam emails, before, for example, in Europe, the GDPR initiative has to do with people's privacy and who owns the information. California, for example, has already adopted similar messages, which means or similar legislation where it mandates a specific set of rules around information, whether it be a patient or just a consumer. Okay, so there's a lot of technology that gets involved here to do this in a secure fashion. There's also a lot of technology here to steal this stuff. Okay, so you really want to be generally aware of it. Now, what's interesting is just like in your own personal habits, right? You find that there are ways you like to communicate with people. Today's world, with the fact that, hey, email them, text them, Snapchat them, Instagram them, go online, call them. There are so many different ways. Now, so the good news is your patients want this type of they want this type of access. Okay, and whether it's coming directly through your EHR, for example, or if you're getting it through other mediums, your patients are happy when you offer it. Okay, I'll talk a little later about just because you offered it, you still want to get permission from your patients in your use and disclosure documentation of how they want to be communicated with. I do find it also interesting is that, and think of your own personal, all of us that buy at Amazon, the majority of us really like to be able to order and pay online. So, giving those type of things are important. Now, the bad news is, with all this great technology and ease of doing this, okay, there's a tremendous amount of breaches or intentional fraudulent acts that happen. Okay, so now, unfortunately, whether it's the 17,000 records that are breached today, or the amount of healthcare, for example, an interesting statistic is if you've heard the term ransomware, 88% of ransomware is specifically against a small and mid-sized healthcare practice. So, for example, I can tell you right now there are 36 open investigations just in eye care where someone stole access, encrypted, whatever, the patient's information or the patient records. Okay. Unfortunately, one of the reasons why HIPAA compliance and communication becomes so important is whether it's security or communications, the biggest one of the biggest culprits here is just simple administrative mistakes. Okay. So although this isn't meant to be a deep HIPAA training, if you audited yourself correctly and you had the correct policies and procedures in place, your staff would know exactly what to do and what not to do. One would make them happy. Two would make their life a lot easier, okay, which means they serve your patients better. You get better patient loyalty. Okay, so general rules to follow. There is something called the minimum necessary standard. So I've heard often people say, I went into a hospital or I went into or a police officer comes into a facility and says, I need to know something about so-and-so, okay? You are allowed to answer those questions. But what you must follow is what's called minimum necessary. This is also appropriate when in social media, when you're responding to a patient. Okay, so minimum necessary is, I'm going to use the hospital example. Okay, police officer walks in a hospital, is such and such patient here? You can answer yes, room 401. What you cannot answer is yes, 401. They clearly were drunk when they came in and had just had an accident. Okay, because that's their information. You do not. It is minimum necessary to address the situation. Okay, if you are going to be getting involved, so one that I hear often is, elder care scenarios. Where you're, the child is coming in and providing care for the adult or the elderly parent, or the same thing with junior or minors that have become of age, 18. Okay, there are very specific rules. Now, in those cases, what you need to do is make sure you have the right forms and authorizations. So your use and disclosure documents should answer those questions. Okay, things like, in your use and disclosure document, the privacy document you have at the front desk, you should be asking me, I can communicate with you in different ways. Is email okay? Is voicemail okay? Can I text you? All the different mediums that you think you're going to be communicating by, you want to ask your patients if that is okay. If they say yes, great. If they say no, then you need to have processes in your organization to not violate what is that request. Okay? Business associate agreements, if you are not familiar with BAs, any vendor who provides a service to you, okay, so whether it's your electronic health records, if you have a messaging platform, if you have a billing firm, an IT company, any software you work with, you're required to do two things before you make use of that. The BA agreement is the legal agreement that says they understand they have to be compliant and that they cannot, that you're responsible for what you do and they're responsible for what they do. Okay, so you want to make sure. One other thing on that one, by the way, is make sure you also have what's called a technical due diligence. Technical due diligence is, have they provided proof to you that they are capable of protecting the information you're sharing? Now, the next thing about HIPAA guidelines are, it must be secure. Okay. Now, secure, and this came up actually. One of the questions I got is there a difference in between an electronic fax and a digital fax. I'm sorry, and a regular fax line plugged into a telephone line. No, and the reason being, okay, if you've heard, I'm going to talk about encryption in a minute, but the reason being is a fax machine is a point-to-point exchange of information. Okay, so it isn't being transmitted in a form that someone can, open it up and steal it along the way. Okay, you're putting it on your fax machine and it's showing up on 5 fax machines. So as long as you enter the telephone number correctly, it's going to the right place. Now, the concept of encryption when you are talking to people, okay, and that is, and I could get very deep in the techie world, but the idea is, remember speaking Pig Latin as a kid, right? The idea is that there is some form of technology that is taking that information, putting a lock and key on it, that if someone stole it along the way, they wouldn't be able to understand what was in it. Okay, and that's the basic concept of encryption. Okay, we can get much more techie about it, but it's just so that anything that's being exchanged, whether it's texting, email, chatting, there are technology to make sure that cannot be intercepted and then taken inappropriately by somebody else. Okay, so now some do's when you are dealing with HIPAA. Okay, now we talked about minimum necessary. Okay, but when you're discussing PHI, keep it to the core what you do for a living. Okay, and that has to do with either you should only be discussing with the patient around treatment, payment, and operations. Okay, so you shouldn't be discussing anything around PHI socially, for example. Okay, when you're discussing PHI, it needs to be specific to what is the questions that are required. Okay, I'm just looking at there's a couple of questions here. I just want to make sure. Okay, so a business associate. One of the questions was, so the next thing is anything around PHI requires a business associate agreement. You do not need to get that. The question was, do I need to get that if a person signs it? Do I have to have it redone every year? You are not required to get your business associate agreements re-signed every year. What you are responsible to do is to look at it and make sure that your business has not changed substantively in the last year. Okay. One of the questions was someone said they're having some trouble with audio. I don't know if that's a common problem. If anyone else is having trouble with their audio, this will be recorded and then available both through the AOA and off our website. It takes us about 24 to 48 hours for it to appear. So if you're having a challenge with your GoToWebinar, there will be a recording available to you. Okay. So now the next thing is when someone requests PHI, do it in writing. Okay. You want to keep it. You want to keep that active for 30 days, and you want to make sure you follow what is minimum necessary. Which means if they asked about, please confirm the appointment that happened on Tuesday the 23rd. Do not discuss the appointment that happened on Wednesday the 24th. They asked you specific about Tuesday the 23rd. That's what you reply back with. Okay. Now, some do nots. Okay. And I would like to think that the people, most people are beyond this, but let's kind of keep the basics. You should not be discussing PHI in a public setting. Okay. The nature of all PHI, protected health information, should be shared in a supervised and secure environment. Okay. So, like for example, that means if you you do not need any materials that are around, let's say at the end of the day, they should at the end of the day be packaged up and put into, let's say, locked file cabinets or behind a door that is locked. So, for example, it's okay if you have things on your desk, provided that the office that was in, that door has a lock on it. Okay, these are some kind of common sense things you need to be doing. And technically, one of the audits that's required under the law is what's called a physical audit. And the physical audit would be helping you look around your organization and make sure that you address these type of open things. Okay, now, I'm not a big fan. I think there are lots of great advantages of being HIPAA compliant. I think it can make your organization more profitable, more valuable from what is private equity firms if you're looking to sell. I do think it also directly drives up what is employee satisfaction, and most importantly, being HIPAA compliant improves patient loyalty. Now, the downside is if you don't do it, it's got some teeth. Okay, whether it is, we had one organization where this is a physical therapist, a patient sent in a written recommendation letter, saying testimonial, how much they really enjoyed working with them. Unfortunately, the organization then decided to put that up on their website. Okay, this is where your use and disclosure documents. The patient didn't give them permission to do it on their website. They'd given them a physical letter that they presumed was going to be not used other than thank you for having taken care of me so nicely. So, that was a $25,000 fine. Okay. The error here, by the way, and you're going to find this universally across almost all of the fines that I'm going to talk about today, they're never for the incident. They're almost always for failing to assess your risks. And this is very common. We have a lot of people who say, oh, Mark, we're just going to use a checklist-based application on a website. That makes us HIPAA compliant. It does not, folks. Okay, there's a whole bunch of things you need to do to be HIPAA compliant. There's, the law is very specific, and you cannot do what's called HIPAA Lite. You cannot just do pieces of it. Okay, so what happens is if you didn't do all the audits, and you didn't have all the right documentation around your gaps, which means you wouldn't have had all the right customized policies and procedures, that's when you start getting in trouble. Okay, so press releases. This was actually a hospital in Texas. They had they had a patient who perpetrated fraud, in this case, fraud, waste, and abuse. Unfortunately, they were very proud of having caught her, and they put out a press release. The problem was in that press release, they had mentioned the perpetrator's name and the procedure that was done. Unfortunately, that was PHI. She filed a complaint, and there was a $2.4 million fine. Okay. Next one that comes up is a lot of you are very proud of the beautiful rooms you have created for display rooms for your frames. Understand that if you want to take pictures or film that, you need to make sure if there is a patient that is in there being served, that you have permission from them to be in your video. Okay, do not assume that is okay. In this case, there were multiple times in emergency rooms where film crews were in there filming the event, and then did not get permission from the people in the background that it was okay for them to be displayed. Okay. Another big thing, which is, fines that are easily avoided. Okay. Now, when it comes to business associates and what has to do with you, most of you are using third-party technologies to help you with your managing your communication, whether it's email, patient portal, texting, etc. Now, the bad news is that 30% of the time a breach happens, it was caused by your vendor. Okay, and there's actually a recent one where an EHR had the virus and then gave it to all of their clients. Okay, so why does a business associate agreement so important in this case? Unfortunately, the number one thing that you get fined for is not having BA agreements. Why that's so important is if you had a BA agreement and you did it correctly, you would have had two things in your favor. One is you would have also done it, if you're not doing technical due diligence, or you're talking, or in today's world, or whoever is helping you with your compliance isn't doing a technical due diligence of your vendors, you're breaking the law. You're also increasing your risk dramatically. Why business associate agreements help so much is because if you have a BA agreement in place and you've done your technical due diligence, when something goes wrong, you can defend your organization and therefore not get fined or get involved with a class action lawsuit, because you can prove that you had a document that said this organization said they were HIPAA compliant, and they said that they would be responsible for all the HIPAA related issues that happen on their side. Okay, without it, on the other hand, the government doesn't know whose fault it is, and they pretty much come and fine everybody. Okay, so you really want to be, BA agreements are the best way to lower your liability. One thing that comes up a lot, if you have a vendor that won't sign a BA agreement, go find another vendor. And I have personally been involved with some situations in the eye care market where some of the vendors were asking the ODs to sign BA agreements that indemnified, which meant that that the vendor was not going to be liable. That is technically against HIPAA law. Okay, so if you have a vendor that's asking you to do that, I suggest you get another vendor. Okay. One of the questions is it HIPAA compliant faxing over phone if not connected to the computer? That is going to be a subject of the technology and whether you not have it encrypted or not. So actually, I'm going to start getting into what is the next part of what's required. So bear with me for that particular question. I'll answer that in a little bit more. Now, if you don't care about HIPAA compliant communications, which would be surprising because you're on this call, do understand that your patients do. Okay? 68% of the people were not confident that their healthcare provider was protecting their medical records, and over half of the identity fraud cases that exist, it is the patient's belief that it was caused by their doctor. Okay, it was that it was their provider. The provider was negligent in protecting their information. Okay, so there's lots of different ways that happen. So now we start getting into, to answer your question, over faxing versus phone or computer. The concept is a secure communication. Okay, so what happens is certain types of communication are inherently secure. But for example, a regular Gmail account is not secure. It is not encrypted. It is not backed up correctly. Okay. Now, sometimes you can get involved with applications like, for example, there are applications like WhatsApp, or there are many secure platforms you can pay for patient portals that make the communication that's going on secure. And the idea is, the easiest way to think of all of this technology is, does it protect the fact that you sent it to me, that no one along the way, if they stole it along the way, could they use it? Okay, and vice versa. When I respond to you, are we confident that the technology between the two of us is protecting that information so that someone couldn't grab it in transit, which is kind of a fancy word. Okay, now, encryption in general gets very deep. Okay, now, so we at Compliancy Group feel very strongly if there's anything you do in regards to whether it's how you communicate with your patients or how you run your practice, and that is do two things. Make sure you encrypt all of your information. If that is a techie thing to you, do understand that many computers, so for example, Mac, if you're an Apple user, or if you are using Windows, provided you have the latest version of Windows, Windows 10, both have built-in applications that are designed to encrypt the information that is being exchanged on the computer. Okay, so encrypting is that if someone stole this from you and I, think of ransomware, right? Ransomware is when someone calls you, you get an email that says, I've captured your computer and your information. If you pay me money, I will let you have it back. All right. Now, what happens is, if you encrypted properly and you backed up properly, even though someone did ransomware or someone stole it along the way, they can't use it. Okay. The information is useless. Okay. Now, if you don't encrypt it, and this is why it becomes so important, if you're like, oh, well, it's no big deal, I just texted them, understand that if I intercepted your text and now I know the PHI or the information that is being exchanged, I can now use it. But if it was encrypted, what I would have had was gobbledygook. Okay. Now, there are, on a whole, I try to be very, let's say, neutral about the technology that you can use, okay? But there are some rules, okay? So first of all, HIPAA itself has a bunch of very specific rules. If you go to OCR or HHS.com, OCR is the Office of Civil Rights. They also have a website. You can see a list of what is considered appropriate secure communications. There is also something called, on a global level, the CAN-SPAM Act. Okay, this has rules around emails, how you share them, who you share them with, what are the rules about if a patient gave you permission, etc. WhatsApp is a free app. It does not tout itself as being HIPAA compliant, but because it is a secure point-to-point communication mechanism, it means basically it has an encryption methodology that allows you to send information from one side to another. Because it is secure, that is basically what's required, and that's encrypted. So therefore, WhatsApp as a free app is a good way for you to communicate with your patients. We do a lot of work with an organization called Pawbox. They specialize in helping you make your email encrypted. So whether it's a Gmail account or other Hotmail, Yahoos, they allow you to take what is an inexpensive traditional email and encrypt it properly so that you can use it in that medium. Okay. So now, visually, just to give you, to kind of help you guys understand, this comes up in a lot of different scenarios where people are asking me, hey, why can't I just use one of these inexpensive, easy, checklist-based providers? Okay. The problem is, if you are engaging in that, the majority of them, not all of them, there's many, many good tools in the market. But the problem is, if in your, and I usually do this if I was in an open setting, I would ask you to raise your hands, okay? Most people, when I say, are you HIPAA compliant, they respond back saying, I have done a security risk assessment, I have remediated those security issues, and I have security policies and procedures and or training. Fantastic. The problem is, you see all those question marks? If you're not doing the rest of those things, you are not compliant. You are breaking the law. And if you are not going to address the law fully, my recommendation is hang on to your money so you're ready for the legal fees that are going to happen when you do fail an audit. Okay, and actually, if you're not familiar with the HHS Wall of Shame, you can go on there and actually see all the different. Right now, there are 38 open eye care investigations. By the way, some of them are ours. We are proud to say, though, any client of ours that has been audited, we've been able to prove they made a good faith effort. Bad things happen to good people, but they do not fail their audits. They don't get fines. They don't get corrective action plans. Now, what is required to be properly HIPAA compliant? Okay, so when HIPAA is done correctly, what you do is there are 6 audits that are required every year. Okay, they break out. They if you were to think of them, to summarize them, they are security risk assessments, they are administrative risk assessments, and privacy risk assessments. What you then have to do is you then have to identify all your gaps in writing, and then you have to remediate all those gaps. What we do see is about 80%, about 25% of the gaps that exist are security related. What I mean by security is they're physical things, okay? Locks on doors, email encryption, firewalls for your office, that kind of thing. The majority, and you'll find the majority of fines are levied for administrative fines, and those fines are failure to have policies, procedures, and training. Okay, so you must have not just high-level code of conduct, but you have to have specific policies and procedures and training that relate to each part of your business. Okay, so you want to make sure that they are customized. Buying an off-the-shelf, hey, my local association gave me a binder. That's fine. Did you take the time to customize that binder to make sure, or even if your lawyer did it, or if you're using one of the services that exist online where you fill out a couple of questions and out pops your policies and procedures, be very careful, because if they don't accurately reflect your business, you will get fined. Training, you are required. Now, by the way, with the policies, the procedures, the training, and the audits, you are required every year to do those. And you are required to prove that every year your employees, okay, legally attested that they understood and they're going to follow your policies, procedures. So having, let's say, an open staff meeting and saying we talked about it, great reinforcement, but you need to have proof. So there needs to be, a piece of paper they signed that they understood each one of your policies, procedures, and need to follow it. BA management, it is important that you are both getting the contract, the business associate agreement, and the technical due diligence. Okay, that's your proof that you made sure they could protect the information you shared. Last but not least is incident management. By law, every incident must be investigated. When it is investigated, you have to document who was affected, how you fixed it, what went wrong and how you fixed it, and then ultimately report it to the U.S. government, either meaningful, which is more than 500 people, report within 60 days. Non-meaningful, you have to report at the end of the year. Okay. So we did say, that hopefully, actually I have questions. I'm going to answer questions in a minute, so please start sending them over. If you are interested, you should have gotten the free fact sheet. We also have a free checklist that you can download from our website. If you are interested in somebody helping you with your compliance, we would love to do that. We also have, for AOA members, this is an AOA specific webinar, we offer 3 months free. Okay, so we do hope that you will take us up on that. If you're interested, so if you don't have so the free webinar, the free fact sheet should have been when you logged in today. If you did not get it, if you go to the same URL that you see on the bottom, the compliance checklist, you will find on that page you can download both the checklist, which is a great way to evaluate where you're at, and then the free fact sheet. If you are interested, you are welcome to call me or anybody on my staff, and we will gladly answer questions for you. So right now, let me get to some of the questions, because hey, you people are kind enough to ask them of me. My BA would not sign my business associate agreement, but sent their own for us to sign. I was told this was okay, and I can't really switch to other vendors. What do I do? Okay. Um, Normally the responsibility is on the person who is sharing the information to get the BA agreement. Okay, but it is not. The law is a little bit gray about that. What they want to have is proof that both organizations have agreed that HIPAA is the law that they work under, right? That they both are responsible to be HIPAA compliant, and that each one is responsible for its own efforts. So it is okay to sign a vendor's business associate agreement, provided that you have. Now, if you anytime you're signing a legal document, I would recommend that you should have your legal counsel look at it. Okay. This particular person who asked this question happens to be a client of ours. So the question was, is it okay to use ours? And if it was coming from a vendor back, we both certify. Our seal of compliance is both for vendors and for clients. And the idea is to let you guys have a closed ecosystem where you can safely know that which EHR, compliancy group has vouched for that they are HIPAA compliant, and that therefore you can confidently do business with them and exchange BA agreements without the same BA agreement. Makes it a lot easier for you folks. Okay, and there's a bunch of we have hundreds, if not thousands of vendors that we have done that for, ranging from software to IT, call centers, billing firms, etc. So if you are grappling with that, please do so. But to answer your question, it is okay to sign a vendor's BA agreement. Make sure you read it, because I have tangled with two different organizations in the eye care market that had what we would consider inappropriate language in their BA agreement. That was basically asking you as the client to not hold the vendor liable for what the errors they make. And that's not, in my opinion, that's not cool. Okay. Do you have to have labs or contact lens providers sign a BA agreement? There is two schools of thought on this. Okay, a lot of this has to do with the organization you're working with. Some organizations fall under what's called, without getting really, really boring into the world of HIPAA, is that they're actually covered entities. They're not really business associates. Okay, and in that case, when two covered entities, somebody who is involved with payment, treatment, or operations, are doing business with each other, technically they don't need to have a BA agreement. But I'll tell you my opinion, just as somebody who's been in this in a long time. A BA agreement is a correct BA agreement is just a simple document that says, we both understand the law. I'm responsible for what I do. You're responsible for what you do. In my opinion, any vendor who is uncomfortable to sign something like that is not a vendor I would want to work with. Okay, so if you are grappling, if you have vendors that are giving you grief about that, my recommendation is look them straight in the eye and say, look, if you're not willing to do that, it means you're up to something, and I'm going to go find another vendor. Okay, and if you need another vendor, whether you are a client of Compliancy Groups or not, do know that you could contact us, drop us an email, or hit up our chat, and we'll give you a list of vendors that we know that are HIPAA compliant in eye care or out of eye care. So please don't be shy. So the question was, what was the source you were using to make Gmail encrypted for HIPAA compliancy? Okay, so we try not to specifically say one technology is better than another. We have Pawbox, for example, is a client of ours. That's why we can speak highly of them as being HIPAA compliant. They offer a compliance tool. If you like, drop us an email. We'll give you the links for the right people to call there. But they make Gmail encrypted. Now, other ones that exist, and this comes up a lot. For example, if you are on Windows 10, okay, if you are on the latest version of Windows, it has the capacity. You have to make sure you turn it on correctly. It has the capacity to both encrypt your information on your computer as well as send encrypted emails. Okay, so you don't necessarily have to spend outside money, but there are multiple tools that you can do that with. We have to, like I said, we can vouch for Pawbox because they're a client of ours. So, do you have a sample BA agreement? Okay, sample. So the question was, do you have a sample BA agreement available? We do have one. We do have BA agreements for our clients. They're built into our platform, so the ones we have are meant for our clients, not a free thing to give away. What I can tell you is, if you go to the OCR, the HHS website, they do have some documents there. They do say that they're not giving you a BA agreement. They're telling you what needs to be in it. Okay, so my recommendation would be take that, and you may want to put together a document or contact your lawyer. Unfortunately, I do think that the lawyers, by the nature of what they do for a living, need to charge you a fair amount of money to do that. So there are definitely other sources that you can get BA agreements. But either way, any legal document that you're signing, unless it was provided to you from, let's say, a source that you can truly vouch for, like for example, if an organization like Compliancy Group, I would be cautious and make sure your lawyer looked at it. Okay. All right. Any other questions, folks? You're asking good questions. I'm surprised at the number of people who are concerned about business associate agreements. If you are interested, there is actually a webinar on our free webinar on our website on BA agreements or business associates and the relationship you have with them. So if that's something that it seems like a lot of you folks were concerned with or challenged with, our pleasure to answer those questions. Also, if you are not aware of it, we actually have a Ask the Auditor function through the AOA website. You are welcome to chat my organization, and we will do our best. You do not need to be a client, we do this for the AOA. So you are welcome to ask us questions, and we will do our best to answer them for you, or at least let you know when you need to get, for example, that what happened is severe enough that you need to bring in legal counsel, that kind of thing. So our pleasure to offer that to you. All right. So if there's no more questions, I'm going to give it kind of that going once, going twice. All right, everybody, thank you so much for joining me today. I apologize for any confusion about when the webinar started. So if there were folks that got on here early, my apologies for consuming your time out of your very busy day. We will try to make sure that doesn't happen again. Either way, have an awesome day. Thank you for supporting the AOA. It's an incredible organization. And the one other thing I'm going to give you, a little bit of a plug on is please support the PAC. The PAC is the reason why you have the rights you have in your respective states, or lack of rights in your respective states, is because of what the AOA PAC does and what they fight for you. I am personally a big advocate of the fighting for what is every child before they start school must go through a comprehensive eye exam, and that is because I had a daughter that had a serious visual issue, that if she had just had that when she started school, I would have saved a lot of grief. But fortunately, due to the AOA, my daughter was diagnosed with convergence excess. It was fixed by Dr. Thaw out of New York, if you guys are familiar with her. And because of that, my daughter is a principal's honor roll student. And I am very proud to say it's one of the reasons why we support the AOA PAC so diligently. Anyways, thank you so much for joining us. If you have any other questions, give me a call. Thanks, everybody. Have a good day.